Robert, I have one question. You described the scope, and this scope is very broad, involving many stakeholders in one country, but also in Europe. I would like to know how to prevent gaps between all the implementation of the use case that you presented. As we see, for example, this morning in radiology, where we saw that DICOM is used everywhere, but sometimes there are some specificity. So in IDMP, how can we prevent this kind of gaps?
Yeah, that's a very good question. What we try to do from work package 1 is to really make sure that we stay close to the implementations within the countries. As I said, 11 national competent authorities are implementing at least part of the IDMP solutions and standards. And any problems that they run into, we take up and bring them to the global standards world and try to solve them as quickly as possible there. Also identifying interim solutions, and maybe the standardization process takes a little bit longer, but at least we have a full register of all the issues that the individual participants within UNICOM encounter, and add that and bring that to the attention of the people working on the standards, so that they are assured that they can make changes, or we bundle that experience and bring it to the other countries through the work packages within UNICOM. As I said, we do have a full register of all the issues that we've identified. That's what we started out with in 2020, to identify what are the known issues in implementing IDMP. And we're working hard with the SDOs to solve them and bring that information as quickly as possible also back to the work packages within UNICOM, so they can do that. But it is a challenge, and some people look at the EMA implementation guide for HL7 fire and say, well, that's the truth. Whereas the linkage between that implementation guide and the global HL7 fire standard still needs to be established and maintained, so that we don't get implementation guides that vary from country to country or from continent to continent. So it is very much hard work, and we're determined to stay with it.
Okay, thank you. Any question from the audience? No. So last question from me. A few minutes. So how do you involve industry in IDMP project?
As I mentioned, there's already some IT industry partners directly involved in the project. So there's, for instance, especially for the cross-border part, the community that's responsible for the development of the OpenNCP, the National Contact Point software that's used for the cross-border implementations. They are part of the UNICOM consortium, and they will pilot the changes that are needed to the software in order to make sure that that this happens. Of course, we also have the outreach through IHE to the IHE Connectathons, and you might as well be identified as leading that work, Karima, to make sure that that we have the possibilities to actually test the new specifications with IDMP, with the vendor community that's linked to the IHE-Europe Connectathons. And that will, we're starting the preparations right now, and we already see the first things happening both in the patient summary part for both the medication list, but also for the vaccination or the immunization part of the international patient summary, where it's crucial that we get a global identification of vaccines. We've been working on that, especially for the COVID vaccines. And there's also a broader collaboration going on outside UNICOM between the European Medicines Agency, the FDA, the WHO Absolute Monitoring Center, to come up with global vaccination identification. And there will be a community of expertise on that in the fall. I think maybe October, November, we'll have the outcomes of that initiative presented. But we're already working on a list, and I have been working also with the HL7 Fire Connectathon on a list of these are the IDMP compliant identifiers for the COVID vaccines. So they are, at least in a pilot situation, they're available for use.
Thank you, Robert, for all this explanation and very rich presentation. And it's now time to have the transition to industry and to the community of industry with Danny representing the COCIR. So I will introduce Danny. He will present the vision from a vendor association point of view in vision in Europe. Danny van Roijen, I'm not sure I pronounced correctly, is a digital health director at COCIR. He is coordinating the association digital health activity. Danny focuses on European policy making, including in the area of artificial intelligence, interoperability, mobile health, cyber security, and data protection. Danny represents COCIR in different initiatives like AI for People. He is also a member of Stakeholder Cyber Security Certification Group established by the European Commission under the EU Cyber Security Act. So on behalf of COCIR, Danny is sharing the healthcare working group within an international association for trust in blockchain application. And now I will let the floor to Danny for his presentation. Thank you, Danny.
Thanks, Karima, for this introduction, and thanks to IHE-Europe for inviting me to speak today. I just want to check if you can hear me clearly. If you can see.
It's a little bit, we don't hear very well.
Is this better now?
Can you speak up, please?
Okay, I will.
It's better.
Okay, can you see the presentation?
Yes, it's fine.
It is the presentation mode.
It looks like yes.
Okay, I think I'm set to go. So first of all, so thank you for having me today, and apologies on behalf of our Secretary General, Nicole Danjois, who was originally intended to speak, but is currently ill, and she would have be pleased to be here as well, because she has been connected for a very long time with IHE-Europe. So that's why it is up to me today to provide some insight on the vision of the future of healthcare. And we believe that the future of healthcare should at least be interoperable. So first of all, a short introduction as to who we are, COCIR. So COCIR is a European trade association where we were founded back in 1959, and we're representing the health technology industry in Europe. Historically, we have been largely representing medical imaging, radiotherapy, health IT, and electromedical industries. And we as an association have different working groups, but the main focus, the main objectives of our industries association is to focus on two key items. So the first one, value and health, and the second one, digital health, of course, because we believe in the potential that the innovation of digital health solutions can bring, in the sense that it can be a benefit to the patient, to the healthcare professional, and also to society. Now, with that introduction, let me just start with my presentation. So as a kind of icebreaker, you might be familiar with the person on the image, on the picture. But this person, this is Gordon. And Gordon, he sits on an island and he wants to communicate with the world. So what does Gordon do? Gordon has limited means to communicate. So he puts a message in a bottle and he throws it into the sea, into the ocean. So you won't believe what happens next. Waking up one morning, he goes back to the beach, and all of a sudden there are 100 millions or billions bottles washed up on the shore. So you're probably by now familiar with the song and with the person on the picture. But in a way, we could say that it is a kind of interoperability miracle. I mean, Gordon had data, information, a message he wanted to share with the world, and he was just able to throw it into the sea, and he received a response in the same format, in the same way that he communicated with the world. And people understood what he had to say, and he understood what they had to say. So in a way, this is a kind of interoperability miracle. Of course, Gordon, or Sting as we know him, he did not work in healthcare. So coming back to current days, not the 70s. So this is Europe. Europe has 27 member states, and Europe wants to make health data available. And they want to do that for two main purposes. First of all, for the provision of care, and second of all, for research and other purposes. Now, instead of you won't believe what happens, no, here are the cases you won't believe how difficult it is. Because Europe, with the UK gone now out of the European Union, may no longer have a big island, but in a way, all these different member states are islands by themselves. And within each member state, there are many more islands, because in principle, there are a lot of collection points for data, for health data, and also points where health data is being generated. But for some reason, people that are collecting and generating that data are not always able to share that data with the world in the way they want to. So there are clearly issues with interoperability. Now, in the same way, we could say, okay, let's not give up all hope, because in a way, we have a kind of interoperability miracle. With the COVID-19 crisis, there has been an accelerated progress on a number of new technologies to cope with the current pandemic we're facing. And one of the most recent examples we have, and the one that has also been presented today in earlier sessions, has to do with the EU Digital COVID Certificate. And the EU Digital COVID Certificate is one of the first technical solutions that has been rolled out in such a short timeline and has been clearly focused on interoperability. So in a way, we have had the once in a lifetime opportunity to witness an interoperability miracle. But in daily practice, miracles usually don't happen. So we have to work with what we have. Now, if we talk about the future of healthcare, we talk about the digital transformation of health and care. And for the European Commission, they defined, or they focused the digital transformation of health and care along three main pillars, three main axes of action they would like to undertake. The first one is the citizen secure access to and sharing of health data across borders. The second one is to better advance the research, disease prevention, and personalized health and care by making health data available. And then the third one is providing digital tools to citizens to have them empowered and to shift towards a more person-centered care. Now, all of these three objectives are clearly interlinked with interoperability. And for each of these three objectives, you could identify interoperability as being a key barrier as well as a key enabler. And that is something that we as industry have been focusing on. Interoperability may have not been the main issue back in the 70s when Gordon sat on his island, but in the meantime, with the digital transformation, more and more it has become evident that it is a barrier for the easy and smooth exchange of health data, whether that is health data exchange between healthcare professionals, or from the healthcare professional to the patient, or from the patient with other relatives or carers or other persons that are involved in its care process. So clearly there are barriers in place. At the same time, fixing the interoperability or anticipating possible interoperability issues will ensure that we can make use of new scenarios, new ways of gathering data that can be used for the provision of care and for driving health innovation and research. We, for instance, see now that clearly there's a proliferation of technical means through sensors, through wearables and consumer equipment to generate data that basically can be generated 24/7. We don't need to go into a hospital to provide this data. No, we can generate and collect this within our daily lives. We can automatically send it to those that need the information, and the persons that are taking care of us, that are following up, they have a better overview of what happens to us. Of course, on the condition that the data can be shared with them. Of course, interoperability has been a barrier in the past, and one of the reasons for that has not only been due to lack of awareness, but also due to lack of incentives. So the question is, what is the business case for interoperability? And as we now embark on a more digital journey, it becomes more and more apparent that access to data is important for everyone. It is important for the medical device industry, it is important for medical software, it's important for medical research. Now, the only way we can facilitate that, of course, is by taking the first step. You cannot expect people to be interoperable if you don't take the necessary steps by yourself as well to be interoperable and to be open to data exchange. So clearly, more and more, there is this organic, natural process of interoperability where clearly business also has an interest to be more interoperable. Having said that, however, incentives may still be required in a way that demand and supply side should meet each other when it comes to interoperability. Clearly, interoperability has been underused as an element or a criteria for public procurement. In the same way, the specifications have not been standardized, which means that for the industry, for the manufacturers, it has been a customized approach, or there has been little incentive to invest in better interoperability because there has been no reward. At the same time as well, we see that within the healthcare value chain, the incentives for interoperability are not always directly attributable to the one who makes the investment. So it also means we need a kind of feedback mechanism or a kind of incentive that supports people and organizations to take efforts to become interoperable, even if they don't have a direct benefit. And then a third question that we can discuss as well is, how will interoperability evolve as the ecosystem changes? As I mentioned before, we are seeing big shifts in the way healthcare is being provided. The traditional healthcare facility, with the hospital being the center of where the patient goes to be treated, is more and more changing into a preventive approach where the patient is much more mobile, but the care is much more person-centered, and that he is not always, patient does not always need to go to the hospital. He can deal with his care process from his home or from somewhere else. And in that sense, COVID-19 has also been an accelerator for the use of mobile health and telehealth. We should be aware, however, that although this might seem quite promising, we need to make sure that this will translate over time into a structured approach. Some of the measures that we have seen put in place over the past year are basically just emergency measures. They're just ad hoc solutions to cope with the current restrictions and challenges we face because of the COVID-19 pandemic. We need better integration between mobile health and telehealth solutions, for instance, with the electronic health record. So moving a bit from the daily reality towards the future and also looking to what is happening at the policy level. One of the high priority items for the European Commission has been the European health data space. The European health data space, as it is currently being presented, is comprised of two main systems. The first one, typically called by the European Commission EHDS, or European Health Data Space 1, is infrastructure we already have in place today, be it limited, and that is the MyHealth@EU. It is the possibility for cross-border exchange of electronic health records between different member states. So far, we have only seen 7 to 8 countries which have been able to exchange several parts of an electronic health record with other countries. So far, this has been limited to the e-prescriptions and the patient summaries, although work is ongoing within the X-eHealth project, to which COCIR is also an involved stakeholder, to also expand this in the future for lab results, hospital discharge reports, and imaging. So the hope is that we will see a further uptake by more countries, as well as more domains where there will be a cross-border exchange. Now, realistically, from an industry perspective, we fully support this, and we think it's also important that there's a lot of effort being put into this, for the reason that you cannot have cross-border interoperability if you also not focus on intra-border interoperability. And we strongly believe that the work that is being done within the X-eHealth project will also set direction at the national level for interoperability. The European Health Data Space 2 will be a larger system that will focus on making health data accessible for research and other purposes. This is currently under discussion and consideration by the European Commission. But the basic idea would be that there is a kind of federated structure that would bring together different nodes of health data. And there would be a possibility to access that health data on the specific conditions in order to use it for health research and innovation. And also there, once again, there are a lot of questions and challenges around the data quality, around the fairness of the data, whether it's findable, accessible, interoperable, and reusable. And there we're also strongly involved and invested in the TADAS project, the Joint Action on the European Health Data Space, which has some dedicated work packages looking into the interoperability issues and the data quality issues. Furthermore, as COCIR, we're also partnered to the UNICOM project, which Robert has presented just before me. We're also a stakeholder in the Beyond 1 Million Genomes project that looks into the creation of a kind of genomic data space in order to drive research based on genomic information that can be shared. And we're also on the external stakeholder board of the Interoperability project, which looks into the means of putting the electronic health record into the hands of the citizen through his mobile phone. So these are some of the ongoing projects that we are involved in as an industry, and where we strongly believe that the interoperability issues that are being addressed there, if we can overcome this, we can turn interoperability from a barrier into an enabler. When it comes to the European health data space, we believe that there's a strong coordinated effort needed because the healthcare ecosystem is very complex. And as mentioned before, there are a number of actors that may not have direct benefits or incentives to focus on interoperability, but to have them on board is very essential to ensure that we open up the health data to a wider purpose that would benefit patients and society. We are clearly supporting a multi-stakeholder approach. This is also the case in these projects, and we strongly believe there should be kind of synchronization between these different projects to ensure that we can make use of all these efforts and bring all this expertise together to solve the current issues. As mentioned before, and this is also the case for all of these projects, we believe that these will be able to set the standards, to define common models that will allow us to also overcome interoperability issues at the intra-border level and not only on the cross-border level. Before concluding, I would like to present some of the recent work we have been doing as well in working with stakeholders and also trying to create awareness around interoperability with a wider ecosystem. In the course of last year, we have worked on a white paper on interoperability for effective mHealth deployment that was released 1 year ago in June of last year. And we have been very honored and proud to do an update to this paper in cooperation with IHE. They have been kindly providing an additional chapter in which they present a number of very concrete use cases where it is being made clear how IHE profiles can contribute to a more smooth and seamless experience for patients and for healthcare professionals. In this paper, we focus on the elements of collaboration, the need for specification, identifying the needs, as well as educating the stakeholders. Coupled with that, we also set out a 7-step approach together with IHE on how to move forward on interoperability projects. To first of all, identify the use cases, to select the profiles and the standards, then refine the data content, write the interoperability specifications, organize the testing where we believe IHE has a lot of competence as well, educate the end users on interoperability, and also organize the interoperability governance. We need to look into the sustainability of interoperability as well. And then a second effort we have been doing, and this will be released in about 2 weeks from now, is a paper in which we assess FHIR. FHIR has seen a lot of interest within and outside of the traditional healthcare sector. Within this paper, we would like to create awareness on some of the pitfalls and shortcomings of FHIR, while at the same time also motivating stakeholders to invest time to collaborate on standardization and the uptake of interoperability through FHIR-based standards as well. And also there, we see a specific role for IHE. So this is currently going through the final review, and we hope to present this before the end of this month. So with that, I come to the conclusion of my presentation. If you have any questions, feel free to reach out to me, and I will also share with you an overview of some of the publications we have done now and in the past. And you may not be surprised that we have done quite some publications on interoperability as well, going back for at least 10 years, probably longer. I mean, I'm only with COCIR for 2 years, but we have a very long tradition working on interoperability issues. It's one of the key aspects we focus on with our members, as well as with the European Commission and with other stakeholders. Thank you for your attention, and I'm welcoming questions you may have.
Thank you, Danny. There is one question on the chat. So from Robert Stickway, what types of incentives would be industry need to adopt standard in a consistent manner, project by project? In the Netherlands, a legal obligation, including formal certification, is being developed. Is that the type of incentive industry is looking for?
Yes, this can be helpful in a way, but of course, we for instance have EHR vendors that are only present or focusing on one specific national market, but there are other players that are present in many different markets. So we need to make sure, of course, that we have a kind of harmonization across Europe, because otherwise we're still killing the incentives. We do believe that there should be a stronger indication and guidance coming top down. And we also need to make sure that we involve the procurers, the purchasers, because there we mostly see a lack of familiarity with interoperability, or specifications they put forward into their specs maybe too customized or maybe too unclear, or so there could be better ways, first of all, in sort of the engagement with procurers, to come to much clearer focus on kind of standardized requests for interoperability. Also, what we have seen in the past is that the European Commission has put out a recommendation where they recognize a list of IHE profiles that has been put out, I believe, about 5 years ago. But there has never been a real follow-up as to what extent that has been actually used. And we also have the impression that people have forgotten about this, and so it should be better communicated. At the same time as well, as COCIR, we have also been involved in the past with the Eurocast projects, which some of you may know, and at least certainly Karima was deeply involved in that work, where there was also a project looking into a conformity assessment scheme for interoperability. That might also be a way, if we would be able to cover most of the interoperability requirements to kind of common framework, that would certainly help to have a more guided pathway for manufacturers as well as for procurers to know what are kind of things they need to work on when it comes to interoperability.
Thank you. We are at the end of this session. Thank you, Danny. Thank you, Robert, for your very interesting presentation. I would recommend to the audience to participate to the VIP2 of the Connectathon. As you know, IHE experience is actually in parallel with the IHE-Europe Connectathon, and the next VIP tour is at 4:30. And please do not hesitate to register for this VIP tour. I would also say that all the presentation will be are recorded and will be available soon in IHE-Europe website. Thank you for your attention. Thank you, the speaker, and enjoy for the rest of the program. Bye-bye.